Hello. This has been a crazy year. Coronavirus, or COVID-19, has rearranged life in almost all countries around the world. All of us have had elements of our days changed. Whether it be wearing masks, washing our hands more often, dealing with homeschooling kids, altering how we spend our social time, or, unfortunately for some, dealing with infection or even loss. I personally will be glad to see the end of 2020. Like many companies, Panolam had to adjust at very short notice to a business environment nobody had anticipated. It is a testament to all our efforts that Panolam survived and is partway down the road to recovery. Thank you for the sacrifices you each made and the contributions you all made to allow us to reach this point. We are not completely out of the woods, but we are heading in the right direction. Should I even use the phrase out of the woods when our plants in Auburn and Huntsville are surrounded by millions of trees? I want to talk today about our health plan and changes we are making for 2021. Working with our advisors and insurance company, we estimate that the total costs of our program will go up next year by over 11%. Now for some good news. Given everything that has happened in 2020, we have decided not to increase the amount you contribute in your paycheck for your medical and dental benefits. That's right, no increase in your payroll contribution amounts. The company will absorb this substantial cost to keep your contributions unchanged. To do this, we do have to make a few changes in the way the health plans will work. You will get plenty of paperwork that explains this in detail, but let me try to outline a few key points. First, we need to increase some of the deductibles and out-of-pocket maximums on the base and premium plans. While not changing the deductible on the HRA plan, we will be reducing the company contribution. Since the amounts involved differ depending on plan and single versus family, there will be a table in the supporting materials you will receive that gives all the details. Second, let's look at out-of-network claims. The vast majority of you stay in network for doctor and hospital visits, prescriptions, blood tests, and more. Please keep doing this. If you go outside the network in 2021, the reasonable and customary reimbursement amount will be decreased from 300% to 110% of Medicare. This will likely mean you would have to pay more. There is an easy solution. Stay in network. It saves you money and it saves the plan money. Third, emergency room visits are incredibly expensive. For true emergencies, they provide critical and necessary care. There are many times, however, when a doctor visit or an urgent care center can address the issue. Cigna provides a great chart to help decide the appropriate level of care. You will get one of these charts in your package. There is even a helpline number to call. This is what the chart looks like. We need to increase the charge for going to the ER from $125 to $150 in the premium plan and from $200 to $250 in the base plan. Obviously, go to the ER if you or a loved one requires it. We received some interesting plan level information from Cigna. Plan level means that we do not see individual participant information. To date, in 2020, 17 emergency room visits could have been addressed using an urgent care center, and it would have saved the plan many, many thousands of dollars. Remember, any savings for the plan is ultimately savings for each of us, as it helps Panolam be more generous the next year. In each of these 17 cases, there was a Cigna contracted urgent care facility within 10 miles of the member's home. Fourth, let's look at prescription drugs, which continue to increase in cost. In an effort to manage this, Panolam will be moving from Cigna's standard drug list to the value drug list. This will involve changes to the tiers in which certain drugs are classified, and some medications on the drug list may have extra requirements before the plan will cover them to ensure you are receiving the right medication for the right situation. Also, certain medications that are used to treat allergies, for example, Allegra, Clarinex, and Zyzal, and heartburn stomach acid conditions such as Nexium, Prilosec, and Prevacid, I may have said that wrong, are excluded. That is because these medications have over-the-counter alternatives, which are available without a prescription. The formulary will now only cover generic versions of these medications. Those of you impacted by this change will receive additional information directly from Cigna at your home address. Fifth, if your spouse is eligible for health care coverage at his or her work, but you choose to have them on one of Panolam's plans, we will be increasing the spousal surcharge from $75 a month to $100 a month. This helps offset expenses that the spouse's employer would otherwise carry. The other company should carry their own weight. Sixth, vision care will no longer be a part of the medical plan. For those who want a vision benefit plan, we have negotiated a good rate for care and hardware every year. You can elect to enroll during open enrollment, and you can choose to subscribe. Lastly, something that is not a change to the plan, but is very much health related. Smoking can have a drastic effect on length and quality of life. This affects the smoker and those who love them. Many companies have introduced a smoking surcharge to help offset some of the extra healthcare costs smokers incur. We considered that for 2021, but have decided to put off that step until 2022 at the earliest. However, we do want to stress that we have a great smoking cessation program available free as part of our healthcare plan. We will be giving out more details on this in the near future. I urge all of you who smoke to try taking the program. Both my parents smoked when I was a kid. When they visited me in my first apartment, I remember asking them to smoke outside. The look I got from my mother was certainly frosty. Happily, they both quit in their 50s. But COPD affected my mother's breathing for the last 15 years of her life, and my dad had several bouts with pneumonia before his death that were not helped by his reduced lung capacity. However, their doctor confirmed that they would have been in much worse shape if they had not quit when they did. Please, please, if you smoke, think of those you love and who love you, and take the course. So in summary, we have held the line on what you contribute from your paycheck to the cost of these benefits. I really hope this helps. We have had to make some other changes to try to manage overall costs and costs to the company. I appreciate your understanding that we are trying to balance a lot of economic pressures on the company, while recognizing that each of us have to make a budget work as well. Feel free to reach out to HR with any questions you may have, or call me at 970-231-1098, or email me at peter_jones@panolam.com. Thank you again for all your efforts and contributions this year. Let's all hope for a better 2021. We will succeed together. Thank you.